To what level have we been able to curb the spread of Lassa fever to this time?
Well, what I would say is Nigeria is currently recording more cases of Lassa fever, and I would say that that is, in a way, a positive thing, because in the past, what might have happened is that people will be recording cases, people will be coming down with the disease, and we won't be having them reported. So the increase in the cases reported is good for the country, because what we would have had in the past is people are ill, they either survive or they die, and we don't know what caused the death. So with this, what we are also asking for is that people should continue to report whenever they have the symptoms of Lassa fever. Currently, the country is saying if you have fever, report for malaria check. If they check for malaria and it is negative, the healthcare workers should suspect Lassa and they should report immediately. We're also saying if the person has fever and the person also has sore throat, that's a very strong indication. Samples should be collected and sent to the appropriate laboratories for testing. We are not supposed to pray for or wish away the numbers. The numbers of people that report for suspected cases is very important. We are not saying, and this is not the only part of the world where we have seasonality to outbreaks or diseases. Currently, I know that in the West, they are currently talking about flu, and everywhere you go online, you will read about flu. So the same for Nigeria. We need to know that this is our period for Lassa fever. We are also recording meningitis in parts of the country. These are the realities we have to deal with, and we have to really address the situation head on. What we are worried about is the number of survival from those cases that we're able to have. So currently, I know that we have 47 deaths. From the numbers you shared earlier, there's an update. According to the last situation report released by the Nigeria Center for Disease Control, we have 193 confirmed deaths. 193 confirmed cases. 193 confirmed cases and 4 probable cases. Out of these, 47 are died, which is about a quarter of the total number of cases we are having. One of the core areas we need to improve upon now is we need to detect more cases early, and we need to make sure that we treat them early so that we can have more survivors. Okay. 47 deaths is a lot. One death is a lot in itself, so 47 is actually a lot of people. Now we are hoping that looking at the median age being recorded, we are having a lot of young people.
Brilliant. Let's look at this further and see how wide the responsibility of the government will have to, take a foot and step its foot down to try to get this right. The World Health Organization, the WHO, says that Nigeria has to be seen to prioritize healthcare, and in doing that, it must at least spend a minimum of 6,908 naira per Nigerian in a year, which, when multiplied by 180 million people, will get about 1.2 trillion naira. It is currently spending a dismal 157 naira, going by the 2018 budget of consolidation. What do you make of that? If we have to go that way against looking at situations like outbreaks of hemorrhagic fevers, like this one that we have in our hands, talking about Lassa.
So the whole process of Nigeria accomplishing universal health coverage for the whole citizen is a broad narrative. Beyond the public sector investment is also the attitude of citizens and individuals and even the private sector. But I know that the number one spender on health in Nigeria should be the government of Nigeria. And that number you mentioned is a fact. How do we go out there to accomplish that number? In fact, I know that institutions like the National Health Insurance Scheme are expected to lead in the process of ensuring that that fee is paid to the healthcare provider when that Nigerian goes ahead to utilize care. As it is today, the NHIS has been able to provide that coverage to just a number that is not even clear as it stands, but we know it is less than a percentage of Nigerians. Really, what Nigeria as a country needs to do is to bring health forward, even in the political narrative, to be able to say that, look, the average citizen needs to start prioritizing the issues of health when it comes to even selection of leadership. It is supposed to be one of, look at, if you go to other countries, you cannot joke with the NHS in the UK. You cannot joke with the with the Affordable Care Act of the United States. Look at how much debate it generated when we had reports that it was going to be repealed by the current president of the United States. So the work of ensuring that Nigerians actually go out there to even prioritize the demand for these things is actually another important thing. But as we do that from the citizen side, we hope that the political leadership of this country also sees these things for what it is. Look, every other thing seems important, but the utility that is driving every other form of utility in this country is still healthcare. Whatever we are looking for, from food to clothing to infrastructure, everything still boils down to better quality of health, better quality of life. And if we're going to talk about quality of life, this is just a pure healthcare issue. But
you talked
where
about...
it stands today, the citizens of Nigerians and Nigeria are not even asking for these things.
My apologies. You talked about the NCDC, that's the Nigeria Center for Disease Control. I'm wondering how the NCDC is working with state governments, of course, especially the state governments, because we understand so many states are facing this outbreak. How are they able to work to ensure that state governments are well informed and have that apparatus to prevent this virus from spreading further?
Okay, so the first thing is, in every state in Nigeria, there's a state epidemiologist that works in the State Ministry of Health. And that state epidemiologist is the person that champions the process of outbreak prevention, outbreak detection, outbreak response. So these persons have been the single point of contact for the Nigeria Center for Disease Control in terms of the coordination of the command and control process of the outbreak response. Now, the extent to which the state epidemiologist is not able to implement what the NCDC has recommended is to the extent the state government has financed the work of the state epidemiologists. What we are recording at the moment is some of the state epidemiologists are poorly funded. So
Dr.
because
Bakare,
they're poorly funded, their work is not
afraid that
done.
this is where we're going to have to end the discussion. I do sincerely thank you so much indeed for talking to us here on State of the Nation. Dr. Bakare Lawal is the Chief Executive Officer of EPID Alert from our Abuja studios. Many thanks indeed for talking to us.